also have another toy. It's a rubber tip stimulator, also made by Butler Gum. It's called a rubber tip stimulator. So that's what she looks like. Gold handle, rubber tip, super old school. The purpose of this small tip is to massage the gum tissue. So again, it goes around the gum line. You're taking this point down to the gum tissue and actually very gentle pressure. Again, not heavy. Just gently massaging the gum tissue. That stimulates blood flow, stimulates health. Again, disrupts bacteria and removes a little bit of food debris and some plaque. So, method for this. Here's your method. You take the tip, you point it at the gum tissue, and you gently rub the gum tissue. So all you're doing is following the curvature of the tooth and gum, and that little rubber tip is gently massaging the gum tissue as you go around. So you just go tooth to tooth around the whole mouth, super quick. You can kind of go back and forth. You can go across one time. I obviously like going back and forth a few times. Don't mind my retractor getting in the way of the cheek, but don't overthink this. You should be able to do this without the mirror. You should be able to sit and watch TV or read a book and just run this around your mouth very quickly and very gently, so that it's just one more thing to add to your routine outside of the bathroom, so that it doesn't feel like a chore. So you do all of the outside and all of the inside, but you will feel this on your gum tissue, as you should feel it on your gum tissue, because you're gently massaging it. So you just go in that shape, following the curve of your gum, both top and bottom. You can go back and forth with it, or you can just go around one time and then, do the outsides first and then the insides, or the insides first and then the outsides, whatever you decide. Whatever's easier for you, whatever you decide is best. So again, adjunct, not in the bathroom, watching TV, reading, driving, somewhere else besides the bathroom. I don't care if you sit in bed and do this. It's just super simple. You run it around. So it's just going to massage the tissue. Now, I never use these, but after just doing that, it actually feels really good. So it's just going to massage the tissue and just kind of stimulates blood flow. And, it gives you somewhat of the sensation of us running an instrument around your tooth, around the gum line. So if you're super sensitive to that, this should help with the stimulation of that and just help the gums get healthier, because the healthier your mouth is, the easier your dental cleanings are. You don't have bleeding, you don't have infection. So these are tools that help prevent you having gingivitis and periodontitis. So we don't want you having those diseases. We don't want bloody gums. We don't want infected mouths. So if you're not removing the plaque and bacteria effectively, you're going to have an infection. So when you do these things, you shouldn't have any bleeding. If your mouth is healthy, none of it should bleed. If you're having bleeding, your mouth is not healthy. That means there's bacteria present. That means there's an infection present. So it doesn't mean stop doing these things. It means you need to get to your dentist to get a cleaning if you're overdue. All of this stuff is prevention, because I don't care what hygienist is out there. They all want to prevent problems. We were taught, designed, and made to prevent. So everything we tell you, it's just to prevent a problem or to prevent a cavity. It's just, we're all about prevention. So if you keep that in mind and remember that, then you understand where we're coming from easier, that we're not here to scold you. We're not here to belittle you. We're here to teach you, to help you, give you the tools to do the best to keep your mouth healthy. And then it's up to you to do the rest. So that's your rubber tip.